We will go ahead and get started then. And anybody who joins us a little bit later, we can always just loop them in. But again, thank you everybody for for being here tonight to talk about our Master of Health Administration. We're really excited for all of you who are considering our program. I'm going to go ahead and hand it off to our director so she can explain a little bit about who she is, and then we'll take things from there.
Good evening, everyone. As Caitlin said, we're very thankful that you've chosen to spend your time with us tonight. And we hope that we can present the program to you, answer any questions you have, and get you excited about learning more about our program. I am Dr. Deborah Zabalas, and I am the program director for the MHA here at UC. I have a long history as a healthcare administrator. I am directly from the career field, 20 plus years in hospital operations, policy, legislative affairs, service line management. And I moved into academics about 7 years ago full time. I'm also a board certified fellow of the American College of Healthcare Executives, which is the professional society that most general healthcare administrators belong to. There are also specialized societies, but I'm very excited to be here. I'm very excited to be part of this program, and we are CAMI accredited, fully CAMI accredited. That announcement just came. We're very proud of that. It's been a process that we've been going through. It's a very rigorous standards to meet, and we are now in that class of the top programs in the country. So we're very proud of that and very excited to share that with you as well. I'd like to introduce you to a very important person joining us tonight, and that's Jessica Long. And Jessica is one of our alum from the program, and she is the president of the MHA Alumni Association, which does a lot of great things to connect our students and alumni. So I'm going to let her talk a little bit about that and herself. Jess?
Hi, all. Thank you so much for having me, Deb. Greatly appreciated and happy to be here. So I graduated from the UC MHA program back in summer of 2019, and in the past 2 years have been involved first as the executive coordinator and now as the president of our alumni association. So we plan events on a per semester basis. We do educational sessions. So we actually have one coming up next week that we're very excited about. We try to pick timely topics and poll our executive board of alumni as well. So our next event is going to be on hiring strategies. Some of the sessions we held in the past have been on SMART goals, as well as we did one on healthcare worker burnout. So definitely timely topics. And we also host a mentorship list of alumni that you can get in contact with if you have career questions. And we try to plan some social events too.
Thank you.
Awesome. And as some of you may know on the call, I'm Caitlin. I'm an Enrollment Services Advisor here with our online program. Some of you might be working with me. I actually recognize a lot of the names of the participants tonight, or you might be working with a member of our team. And we're really just here to make sure you feel confident about the application process and about the whole steps to kind of considering your next part in your educational journey.
Okay, so you have a lot of options out there, and we recognize that. So why should you consider getting your MHA from UC? So as I mentioned right out of the gate, because that's our exciting news, is we are fully CAMI accredited. It is the only accrediting body. We call it CAMI because saying Commission on Accreditation of Healthcare Management Education is a mouthful, right? So we call the acronym CAMI. And so we are very excited to announce that. So again, that puts us in the league of the top programs in the country. And, it's an external body. It's completely external peer review. There are no shortcuts. There are no, there's no way to get it unless, and it's, again, people come and visit you. They do a site visit, a panel, then the full board of CAMI has to read all the reports and all the information. and agree to give us that seal of approval. So that's a really big deal. And it is for you, it is for us. We also have a great track record of success for our graduates. We have 600 plus graduates we put on there. I actually think we're getting closer to 800 this next year. So the program has been growing. Our alumni base is growing by leaps and bounds. And another thing is that you get to learn from scholar practitioners. And what we mean by that is that we're not mired, in academics where we get, we've been out of the field or we're out of touch with the field. And we've just been in academics with our, noses in books, for a long time. So we have a great mix of those who have practiced in the field, leading academics as well, that blend to make sure that we can bring you the best of knowing what's happening in the field and what it's like to be a healthcare administrator. The field is so diverse. There are so many things you can do. That being said, I would be shocked if there's any branch of healthcare administration where we don't have at our fingertips somebody on our faculty, staff, alumni board, that's worked in that area. And but we also have leading academics, so we take advantage of all those best practices for online course instruction and delivery. So we think we really have the best of both worlds to give you the best academic experience and the best real-time, real-world application. Our curriculum is innovative and it's ever changing. We update all of us. We update our curricula every year. For example, anytime we're in a course and any of the resources that we may use, start to get a little bit outdated, especially with data. We update those every year at a minimum, but we have eyes on every single semester. So we make sure the curriculum reflects what's happening in the field. It's timely, it's relevant, it's current. So we're always taking the feedback from our students. We're taking what's happening, in the industry, and we're bringing that in real time to the curriculum in every single class. So there's, I say it's fresh, it's current, it's not stale. You're not going to get into a course where something is in there that's, 15 years old. So we take great pride in that. And then of course it's a great field, right? Health administration. I've been in it my whole adult life. I spent some time in the Navy. My healthcare career actually started in the Navy, and I was clinical as a paramedic and did some things like that and decided to stay and wanted to figure out what do I want to do in this field of healthcare. Thought I wanted to be clinical. Always found myself drawn in whatever role I was in to the processes and to the people and to improvements and quality. It's just kind of where my brain went all the time. So I had an opportunity to apply for an officer program as a hospital administrator, and I was fortunate enough to get that. And while in the Navy, I earned my MHA. I have an MHA from the Ohio State University, and really launched, everything that I've done, in my career. So the Bureau of Labor and Statistics puts out information every year on career fields. Healthcare administration is one of the best career fields you can choose. Expected to grow by 32% by 2029, and that tomorrow it'll probably be even higher. So these are just a few reasons: one, to choose us, and two, to choose the field. So another thing that we think sets us apart from some of your other options is that our program is 100% online. There are no campus visits required. That I know that was important to me when I was looking for doctoral programs. I got my doctorate from Arizona State University, and one of the reasons I picked that was this very reason. It was 100% online, no campus visits required, because that's very hard to do, for working professionals. But if there is a silver lining, and it's hard to say that there is any silver lining with the pandemic, but opportunities were created from that event that we all experienced globally. And one of those silver linings, if you will, is that the focus to online education really changed. because there were programs, there's no Harvard University offers online education now. So, there was a period of time where, maybe there were thoughts that the online experience wasn't the same, maybe even in quality or what you get from it. And that kind of has, that's changed. It's been upended. So, although we're 100% online, one of the things that I tout and I'm the most proud of is that we're a very interactive and engaging program. So while there are no commitments that you have to be logged in at your computer at a certain time, or that you have to attend any particular sessions, we do offer live lectures in our classes. So I had one last night. I had great attendance in my leadership class. I was so excited. It was the first one of the semester. And so we offer live sessions with the faculty and we record those. So if you have a chance to sign on, it's great because you get to meet us, you get to meet your classmates, you get to talk just like we are now. So I think you would never feel like you're sitting, on a computer and that it's some static environment where you're teaching yourself or you're just reading things online. It's not the way that our program is. So we're very engaged. So we offer those live sessions where we do lecture insights and lecture material. We do faculty Q&A. We always do one-on-one appointments with any student who asks for it if you need to set up a special time. And again, we record those sessions so that you can hear questions that your classmates asked and things like that. And then also, along with that, our classes, we do live lecture or recorded lectures. So we'll take like a module and we'll take the slides, or whatever, just as if I was standing in the classroom, what I would have done with you in the classroom, giving my presentation and talking with you. We do that in recorded lectures that we've, we try to get a little better at our technology and making them look pretty and whatnot. But at a bare minimum, you get the slides and you get us talking to you about the content like we would in the classroom. So you have those recorded lectures, you have those live opportunities, even though it is fully online. And as Jess said earlier, we offer live sessions with our alumni groups and educational sessions and things like that. So you can be, as engaged as you would like to be. If you're local, maybe you can come to some of our events, come to campus, go to a football game, basketball game, hockey game, what have you. But even if you are not local, we give you the Bearcat experience. You're going to feel like a Bearcat. No matter where you're sitting, I promise you that. So we're also 40 credits. And so that's a really competitive, to get a master's degree and only 40 credits. So you can do it in 2 years. We have an accelerated track, where you can do it in 5 semesters. Then we have a regular track that usually takes 8 semesters, but you have some flexibility in pacing. And again, asynchronous, if you're not familiar with academics, what that means is what I said in the beginning, which is asynchronous means you do not have to be present at a particular time. There are some synchronous online programs, which means you have to log in and be there sitting there with the class. So we're asynchronous. We don't require B and GMAT, at this point, kind of, those test optionals everywhere now. We look at your application from a holistic standpoint. And another thing that we're excited about is we're partnered with the Lindner College of Business. The Lindner College of Business has a fantastic reputation for their MBA program. And we have several MBA students who get a certificate in healthcare administration. So those students you'll be in class with them because they're taking, sort of a concentration in healthcare administration. And then likewise, our students take courses, the finance and economics and a quality course directly from Lindner because they're kind of the experts in those fields, but they've tailored them to the healthcare environment and they did it just for us. So those courses only exist that are offered from Lindner for our MHA students and for students who are getting a healthcare concentration. So in terms of the curriculum, most students start out, we have 2 introductory courses. They're kind of foundational. We have people who, we're tailored as an executive program. So the great majority of our students have experience in healthcare, some management experience, some very senior. We have physicians, we have nurses, but we kind of run the spectrum. But the program is set up for students who have some working knowledge and experience in the healthcare setting. Occasionally, we find a great student who, gets in without kind of that experience because they had so many other things, that made them a great applicant. And, but what we start with always is a look at the healthcare system and the organization and delivery in the United States. So for some, it's a refresher, but it is still, you're gonna learn something you didn't know before. We get into population health a little bit, we get into a little bit of long-term care, we're gonna talk Medicare, Medicaid, all of, kind of how we're organized to deliver healthcare in the United States. And, we compare and contrast that to other systems in other countries and other courses. So, and then the principles of leadership course. We start out with that and it kind of sets you in the right frame where you learn about the US system. Then we talk about leadership principles specific to healthcare. And again, that's very timely, very relevant. I'm updating that course. That's one that I'm the director of. And we update that all the time. We bring in, I had a CEO roundtable session in one of my recent classes. We actually had CEOs from throughout the Cincinnati health systems who came and spoke to the class in one of those live sessions. It was awesome. And so that kind of level sets you. Then Caitlin on the next slide will show us the kind of what we call course carousel. But the rest of the 9 courses, are in the core subjects, that are pertinent to health administration. So that's where you're going to get your finance, economics, you're going to get policy, legal and ethical issues in healthcare, quality improvement, fits into those 9 core areas. Then we end with your culminating experience as a 2-part capstone. And part 1 we call emerging issues in health systems management. And the reason it's called that is that you have a chance to choose your topic. So you've had a lot of coursework now, you have experience in life. Hopefully throughout the program, you've sparked a curiosity, and a passion for something that you want to learn more about. So you get to pick a topic. Part 1 is 7 weeks. Most of our courses are 7 weeks. You'll see that in the next slide. We have a few that are 14. But capstone, part 1 is a 7-week course, and it's really dedicated to helping you choose that topic that you're going to live with. That's going to be your crowning achievement, and you're going to do a lot of stuff with it. You're probably going to present it to your organization maybe, or maybe do a poster for a professional society. So this is going to be a really wonderful experience for you that you can do a lot with professionally. So we help you design it that way. So you're going to pick your topic, you're going to develop a research question regarding that topic, which really means, how do I solve it? That's what you're looking at. This is a problem, and how can we solve it? So then in part 2 of that, that's exactly what you're going to do. You're going to go and look at all the evidence-based literature. You're going to, look at a bunch of sources and information to come up with the best evidence-based solutions, to that problem. So you're going to educate us, you're going to educate yourself, you're going to educate people on ways that we can tackle really prominent issues facing healthcare. And that's how we set it up. I will say that the way we're set up now, you don't do original research because we don't have you go through the IRB and Institutional Review Board. There's a lot of red tape to get access to data, for patients or to involve patients in studies. So we're not quite set up for that. So our project is an applied project, which is what we call literature review style, where you're going out there and you're looking at all of the current information and peer-reviewed literature, talking to people perhaps, looking at legislation, all sorts of different sources, but you won't actually be collecting your own data, and doing things like that. So I do want to make that clear. And then, okay, so when looking at the course schedule, the course carousel as we offer it, those foundational courses, the first 2 that we mentioned, the organization and delivery and the leadership and the global health systems courses, a lot of students take those 3 together because global health systems is 14 weeks and leadership is 7 and organization is 7. So basically you would have, in one semester, you would have 2 classes at a time. You'd have the global health spanning the 14 weeks and it's paced, nicely because it's a longer course. And then the first 7 weeks you'd have organization, the second 7 weeks you'd have leadership. So you'd only have 2 at a time. even though you'd be knocking out 3 courses in a semester if you chose that track. So those are offered every semester, so you don't have to do that. Those courses are offered fall, spring, and summer. We do have some other ones with economic strategy and policy that they're offered only in the spring. So you'd either have to take them your first year or your second year. And then summer, the same way, is the finance classes. And quality and legal, on the other hand, are fall. So where you have some courses in spring, some in summer, some in fall, those you would take in either your first year or your second year. And then when you, once again, capstone, just like the beginning courses, it's offered every semester. So whenever you're ready for it, depending on the pace you decide to set for yourself. So those beginning courses and those ending courses are offered every semester. So we haven't had students have a problem, fitting in the ones that are only offered spring, summer, and fall, because you got to do it one year or the next. So our advisors are fantastic at mapping out your course schedule for you. Okay, so fun stuff. So we already talked about the growth of 32% projected for the field of health administration, but what about the salary? Whoa. So the median pay for health administrators is, it says $104,000 annually. Now you'll talk to a lot of health administrators who are not making that. I know I didn't make that for a long time. Good news is eventually I got well above that as a health administrator, but that's a really actually a good number for with a graduate degree, such as our MHA, and years of experience, say maybe probably 10 years experience in leadership and management as you go through. So that's going to be, lead at a minimum, midpoint in your career, probably with a graduate degree and a lot of experience, but it is very realistic. And some of our alumni that we count as our esteemed friends and alumni, we have, as I mentioned, a lot of physicians. We have a lot of, interestingly, pharmacists take our program. We actually have a partnership with the Masters in Pharmacy Leadership program here at UC, and also the Masters in Laboratory Science. So I mentioned the MBA students that are in our courses, but you also have the pharmacy and lab students. It's very interdisciplinary, and it's probably maybe my favorite thing about this program, because your life as a health administrator, if you are choosing this as a career field, your entire focus is an interdisciplinary group of people. When you run any type of organization, I was, for example, one of my recent positions was as an executive director of a heart and vascular service line. And as a service line executive director, I had all of those folks, that reported up to me and that were such team, such integral parts of the team to improve care. And Jess mentioned how much she loves the interdisciplinary aspect. I'll let you speak on that in a second, Jess, too, if you don't mind. And we do have a lot of CEOs, CFOs, COOs. So when you're in this class, no matter where you are, I think in your career trajectory, you're gonna fit in. Okay, so you're gonna have some people on the early end of this spectrum. You're gonna have a lot of students in the middle part, and you're gonna have some of these senior people, the physicians, the CEOs, and whatnot. And everybody knows that. And it's a chance for some of our senior leaders to shine and really mentor some of their colleagues. It's a chance for you to learn and bring fresh ideas to them. So we have director of operations, a lot of that. We have many of our students actually with the VA. We have medical directors. We have folks in the finance industry and IT, human resources. So kind of this is just a gamut. Jess, if you could pop in here for a second and talk a little bit about career fields that you know.
Sure.
Yeah.
Yeah, when I was in the program, I would say I, worked with all of these types. I would even say some PT, OT, athletics directors, all different areas. So it was really enlightening to me, especially the discussion boards. So you could kind of understand someone's background and why they have the perspective that they do when they come to the table and form an opinion on, your topic that week, as well as just working in those interdisciplinary teams on different projects or papers, to really understand each other's viewpoint from the diverse backgrounds. And like you said, Deb, just the different, whether you're early career, mid, or senior, it was just an all all around great aspect of the program.
And data analytics, right, Jess? I'd be remiss if we didn't talk about.
Yes, my background.
Data analytics, Jess. Yeah. Oh, we have software engineers now too, folks that are really heavily, Boston, I was thinking of, in, electronic medical records, design and improvement and things like that. So, good stuff. Okay. What's next?
I think I'm driving for a little bit now.
Okay. Woo.
Yeah, awesome. So just to talk a little bit about the online student experience for those of you who might be new to online learning, or obviously those of you who might be new to UC in general, as Dr. Zavalos mentioned earlier, this is a fully Bearcat program. I think a common misconception with online programs is that you're disconnected from the main campus, from the support and the resources that you might get there. UC is a tier 1 research institution, and you'll have all of those resources and all of those benefits at your fingertips as an online student. So from support system, which in our program looks like a varied variety of advising, from your enrollment services advisor at the beginning, who helps you with your application. That might be me for some of you, to your student success coordinator, who's going to help you navigate the program, help you get enrolled, really work with you from start to finish. And then we do have faculty advisors in the program, lots of opportunity for networking and lots of opportunity to kind of reach a hand out if you have questions. And that graduation support, that support as you're in the program, doesn't stop with just the MHA program. We've got library resources that are available to students. I myself make great use of our writing center for the program that I'm in. We've got an IT department that's for all of our university students, and a lot of different options for online management in terms of like navigating online learning, online mental health resources for students. So there's a lot of different opportunities for you to engage with the resources that are available to you as a University of Cincinnati student. And as has been mentioned on this call already, there's a lot of opportunities for mentorship, whether that's, something that's formal within the program with your faculty advisor, or within discussion boards, or with our alumni board, or also just organic mentorship. There's a lot of really great faculty members in this program. There's a lot to learn from your peers. And as has been mentioned, there's opportunities for you to engage as much as you'd like to. So just to kind of reassure you, if you're new to online, or if you're one of our students who embarked on online journey first during COVID, this is definitely a supportive environment that's going to be beneficial to your schedule, something that you can fit into your life, but that's also going to have a lasting impact well beyond your screen time, or well beyond that graduation date. And we do have a lot of students who will come to our graduation ceremony. So if you're thinking, this is a big achievement, this is something that I'm really looking forward to, we're looking forward to it too. And we have a lot of students who come to celebrate that milestone with us. As far as admissions requirements, I can kind of speak to that a little bit. What we're really looking for typically is somebody with a bachelor's degree. As a master's program, we do require that you've got that conferred already. And we are looking for a GPA of a 3.0 or higher. And the way that they'll look into that, our program's review committee will look at a couple of materials in your application. One of those are your transcripts. And for the purpose of our application, if you've got a copy of yours already, you can upload that yourself. We won't need officials until after students have been admitted. We are looking for 2 letters of recommendation, and really, really important piece of this application are those letters of recommendation. You're going to want to pick somebody who can really speak to who you are as a professional, somebody who you can trust to turn that recommendation letter in for you in a timely manner. And really good tips for those are to have them on official letterhead. A digital signature is always a great opportunity. This is a piece that is kind of out of your hands as a student, but can make a really big impact on your application. So important to be in good communication with the people that you've chosen as recommenders. We'll want to see your resume, and in there, it's always a great idea to highlight any leadership experience you've had. If you're in any professional organizations, really showcase what your work experience has been like, so we can see what background and perspective you're bringing into the program. And then your personal statement. This is another super important piece for the application. And I do encourage you to take some really good time on this piece. Your personal statement is a brief essay. Typically, it's about a page or 2, maybe 2 to 3 pages, where the program committee is really looking to understand what's driving you as a student to pursue your MHA. So we've got some prompts that we like students to answer, and I'll put those in the chat for everybody. They're also available on our website, but it's really just giving the review committee the opportunity to understand who you are, what your goals are, and where you hope to see your career kind of blossoming as you pursue this MHA and beyond that graduation date. Really good news about this application process. It is fully online. It's something you can log into and return to, so you don't have to do it in one sitting. So if you have questions or if you want to sit on things like the personal statement for a bit and really take your time with them, you're welcome to do that. But the other really good piece of news is that our application fee has been waived for people who are applying to the program right now. So typically it is $65 to apply. Right now it's $0 to apply. So definitely encourage you to start that process because we are actively reviewing candidates as we speak. And in the other kind of financial piece, we do have some scholarship opportunities for our program. So one really important scholarship opportunity, and this could affect a lot of people on this call, we do have something called a U to B, or a university to business partnership. And these scholarships are due to partnerships that we've cultivated with different companies, organizations, healthcare systems, hospital systems, where we have made an agreement with that organization to provide a scholarship to their employees spouses, and their employees' dependents who live at home under 25, just in exchange for them letting their employees know that that option is available to them. So this is at no cost to the employer. We've got over 100 different companies that we have partnered with. A lot of those are in the healthcare space. So just in the local area, we've got Cincinnati Children's Hospital, Nationwide Children's Hospital. We do have partnerships with Mercy Health. We've got partnerships with a lot of different laboratory companies across the country, a lot of different healthcare organizations. So it's possible, if you're sitting on this call right now, that your employer is one of our partners already, but we are still actively encouraging people to seek out those partnerships as well. So if the university to business partnership is something you're interested in, I'll be putting some information in the chat about where you can look and see who our current employee partners are, but you can always reach out to your enrollment services advisor as well and just see if that's something that you're already eligible for. Now, another really important scholarship in our College of Allied Health Sciences here at UC sees a lot of military students, a lot of active duty, a lot of veteran students. So this is a really big deal for us. We do have a military scholarship now through the College of Allied Health Sciences for our active duty and veteran students. This scholarship could make you eligible for up to $1,500 per semester. So that can make a big difference for a lot of people. So again, if you have questions about this, military financial aid is something that UC is very well versed in. We're a yellow ribbon school. We see a large population of military students, especially in our online program. So if this is something that you're interested in or you think you might be eligible for, reach out to your enrollment services advisor, because we're happy to explain how to get in contact with our Veterans Services Department and how to know if you're eligible for this scholarship. But that scholarship, again, is per semester. So it's not a one and done deal. And that's how the U to B scholarship is as well. It would be for each semester that you're enrolled in the program. So definitely some great opportunities for financial aid. So for those of you who are ready to take that next step, and I know we actually have a lot of people on the call who have already taken that step, where I've seen your applications come through. Like I said, we are currently accepting applications. The deadline for the spring start, that would be our January start, is December 4th. So I will be adding some information to the chat. I know Dr. Zavalos wanted to say a few things, and then we will open to questions.
Oh, I actually saw a question in the Q&A that I was going to answer from Kimberly Osborne. Kimberly asks, have there been previous students from this program get into a fellowship program, and are there resources for fellowship? So we do not have, a fellowship as part of our program. Again, primarily because we're in the executive style where most of our students are working in the field already. That being said, Yes, the answer is yes on resources. I post, all of the fellowship information that I get, and we get a lot of it. The Ohio State University James has a fellowship every year. We post that information to all of our students, to apply. And, we had one student go through that process, was selected, to do that right, after graduation, but then got the dream job at the same time. So decided to forego it. Last week, I wrote 3 letters of recommendation for students applying for fellowships. There are fellowship opportunities through, certain organizations. A lot of times students find out about them themselves. If we know about it, we post it through American College of Healthcare Executives, again, through OSU, the James, any of those types of opportunities, we advertise them to our students. And, we write letters and we, support. So yes, from that standpoint, we support them, we advertise them, and we support you in pursuing those.
I'll just add to that as well. I know back when I graduated, 2 of my peers were selected for fellowships. I had kind of explored the route at that time, so I can certainly attest to all the amazing faculty who, had to encourage me and who wrote those letters of recommendation. I ultimately just went right into the workforce and, worked my way up there instead, but the route is definitely there.
Okay, awesome. So now we will be opening up to questions. I do just want to say thank you, everybody who's on the call currently, for spending the time with us this evening. We're really excited to see what additional questions you might have. I did post in the chat a list of our current university to business partners, as well as a link to the application. So feel free to utilize those pieces, and we will be taking questions. While we're waiting though, I know that one question that I get oftentimes on the phone from students is just about kind of the impact that earning their MHA could have on their career. So Jessica, if you don't mind, I would love for you to kind of share a little bit more about how earning your MHA really impacted the trajectory of your career.
Sure, I'd be happy to share.
Yeah.
So I think for me, it's definitely opened doors that I don't think that my bachelor's did. It has gotten me into rooms that otherwise I would not have a seat at the table, so to speak. So although my current title might not reflect it, I have been involved in developing 2 new offerings at work. I work more in the consulting, tech, healthcare, pharma space. So I've worked on a Medicare Part B offering, and I've worked on a med tech offering. And we're putting good things into the universe, hopefully an associate director level next year, now that I've been able to take on these products and manage them kind of independently. So start to grow and be responsible for a team. And I would just say the support and the knowledge of the others that I've, crossed paths with as alumni in the program, and the professors as well. Just having that in your back pocket anytime you need help with something. They're great resources. It's a great community to, even if, somebody is looking for a new opportunity to develop their career, just kind of having that network available as well.
Thank you so much for that. It's always so exciting to be able to have an alumni here on the call with us.
Right. And we also post job opportunities. Our alumni are really great. And we've just recently gotten a whole lot better at when our alumni, post opportunities, wherever they work, we're hiring. We're now putting those on our alumni page and also pushing it out to current students in the program. So you kind of get a lot of those kinds of communications on opportunities, whether they be job, whether they be professional development. We host things for you to make it easy internally, like we talked about, but then we also push out all those external opportunities that we get, because when you're a university with a graduate program, we get sent all kinds of opportunities. So we push those out to our students and our alumni. So I think we do a really good job at that.
Now we do have a question in the chat. It says, Do you have any faculty who have experience in mental health settings?
Yes, so we do. My doctorate is behavioral health, and my passion is integrated primary and behavioral health care to improve population health. So those integrated care models, but also we are, this may sound strange, but we are part of the School of Social Work at the college. So we're in the College of Allied Health Sciences, which is very common for an MHA program. But further, we're in the Department of Social Work, which is a little less common. But because it's a great opportunity, and nowadays, actually, it's a very good fit because of all those integrated care models where social workers are part of the care delivery team. But we do, within our program, we have alumni. If you were to see our, I guess you can't see our LinkedIn page because it's alumni, but one of our students, she is a physician, and she is just took over as the director, the chief medical officer, let me get her title right, of the Lindner Center of Hope, which is focused specifically, on mental health. So she's in our program now. She's soon to graduate, and she is in charge of the Lindner Center of Hope. So we have a great many of our students that have connections within faculty, as you asked. There's me, and there are some of our adjuncts as well. But within our alumni base in particular, and current students, that is a very popular vein. We have addiction specialists, we have, things like, any area of mental health. There's a connection within our program, in our coursework, but also those students, those alumni, and within our faculty. So that's a great question, because, and also long-term care, if anybody was wondering about that. We don't have a dedicated course in long-term care. Some programs do, but we do get into some of that in our population health spin, but we have a lot of expertise. We have, for what, I'm not sure what we did to deserve it, but we had an influx of students who joined us that are long-term care administrators. And I'm so pleased, because you wouldn't necessarily pick that out, if you just look at an MHA degree, and if you don't see that as a lot of programs have a separate degree in that, because to be a long-term care administrator, you have to go a different route with hours and things like that. But we have a great number of students from that field who have chosen our program. And so both of those being very integral pieces of population health and improving health outcomes in the US and what we're facing. So great question, and yes.
Now, we did get another question. Do you feel like an applicant's bachelor's degree has to be from certain fields to be considered for the program? And before I pass this over to Dr. Zavalos, I'll just say, as somebody who works with a lot of students who apply to the program, we see a wide diversity of backgrounds in our students. So much like we talked about earlier of the interdisciplinary nature of the curriculum, we see a lot of that in the applications that come through. So definitely not one specific bachelor's degree that I'm looking for when I talk with students who are applying, but Dr. Zavalos can talk a little bit more about some of the applications we see and what they're looking for.
Yeah, so the bachelor's degree, if you have a bachelor's degree in a related field, or maybe in health administration, health information management, something along those lines, health related, that can help you if you're maybe lacking in some other areas, like if you don't have a lot of experience, maybe just a little bit, again, keep in mind our program's designed for, that mid-level to senior, executive type program, assuming you have some experience and knowledge of the healthcare system. So if you have a degree, undergrad degree, sometimes that can offset, because you would obviously have foundational knowledge if you don't have a lot of the work experience. That being said, if your degree is not in the field, that isn't really a concern if you have experience. So if you're working in healthcare, you have experience in healthcare, something, closely related, that is actually a big piece of the application process because of how we're designed. We are designed for students coming from the healthcare field. It's not to say that we haven't taken students that don't have that. Again, we take a holistic view, but in fairness, that is, what we're designed as, the part-time executive, MHA. So it assumes you come in with some level of knowledge, some level of experience for how healthcare works. So if you don't have that in your education background and you don't have it in your work experience, that is a taller hill to climb. But if you have, and also service, we love service. So, if you don't have, if you're thinking about maybe pursuing this later, trying to get competitive for a program like this, service matters an awful lot. So, if you can get out there in the community and volunteer, especially with healthcare organizations and, some of those professional societies, I've had students, that join American Heart Association and, get really involved in, those sorts of things. So service matters, volunteerism matters, all of those things count, but you do not have to have a specific degree. No, it's more important in some ways that, you can demonstrate that you have some experience in the healthcare field.
Awesome. All right. Our next question is about course workload and time commitment and what's recommended for students to be successful in the program.
Yeah. So the honest answer is it varies. There are courses that are a little bit more writing intensive. I say it varies. It doesn't vary only because of how the course is designed. It varies based on the student, interests and whatnot. If you're a good writer, I've sort of always been one of those people that I can sit down and I can start writing and spit things out, and it kind of comes naturally and easily to me. And I might need to write a 3-page paper and I'll have 10 that I got to whittle down because I just start going at it. So then I'm gonna have to whittle it down to something. So for me, writing papers or doing things like that isn't something that was hard for me. So I probably didn't spend nearly as much time as my husband, on the other hand, who's in the MBA program at UC. He's a program manager in the military defense industry. He has no interest in healthcare. So he's in the MBA, and my husband would sit there and he'll be paralyzed, trying to write, a 1-page paper. So it could take him all day to do it. And so part of it has to do with, how what your strengths are and what you like to do, right? But what I will say is our courses are balanced in what I'd say types of assessments and types of learning. So you're never going to be in a class where you have to spit out 10 papers or even 5 papers. Yeah, you have discussion boards that are meant to be interactive, conversational with your peers and colleagues, where you do some research and you address specific things that we've gone over in our lectures. So those are kind of fun, and I don't believe in our program, they're not canned, they're not phoned in. They're actually fun because of as we talked about, the interdisciplinary nature of our students. We get a lot of great engagement and a lot of great information. So we have those discussion boards. Those aren't usually super time consuming, although some students love those and really get into the research and adding information. Then you have papers, you have some journals, you have some presentations. So the type of assignments you do varies. So not a lot of those, are a lot of time. So there are courses, however, and mostly it's the finance and the economic courses. Jess can speak to this, that, you're working in programs like Excel, spreadsheets, databases, things like that. If you like to crunch the numbers, if you have some, finance experience and whatnot, same, you might be able to go through that faster. I would say on average, those courses take students longer. They spend a lot more time working on those. So a lot of it has to do with you, kind of where you feel like your strengths lie and where you want to spend your time. I'd say on average, there's a rule in higher education that says to be appropriate rigor for the credits we're awarding you. So if your course is a 3-credit course, it says that you should spend 2 to 3 hours per credit hour outside that. So that's 6 to 9 hours. So that's what higher ed says, you know, we try to develop around that. So basically somewhere between 6 to 9 hours, you know, per course per week. Did that match your experience, Jess?
Yeah, it definitely did. And again, as Deb said, it kind of it plays to your strengths. So I know for me, writing was more of a struggle, but the case studies or the Excels for finance and strategy, those I kind of found more engaging and kind of go through those a little quicker than writing, where I'm my own worst enemy and tweaking everything or asking my poor mom to proofread another paper for me. So yeah, it all depends on the content area and what the assignment is. But yeah, that definitely would meet my expectations.
Yeah, so that's kind of the gauge. I will say for anyone out there, because there's always somebody out there that is really worried about the finance and economics piece, because sometimes if you're wired to do certain things in administration and you don't want to go into finance, you know, or accounting, you're just like, oh my gosh, you know, I that's scary to me. I will say that the strategy, management, negotiation, some of our finance and economics have been the most popular courses for the students for the reason that they were afraid of it. And when they got in it and found out they could do it and learned a lot, and those particular professors are some of our most beloved from the students, because they know you don't come from it and they go more than the extra mile to make it fun and to help you, you know, master those concepts. So. Oh, electrophysiology, one of my EP physicians. My world is cardiology, Fabio, so welcome. What should I expect from in terms of possible administration opportunities in the field? So most of our physicians who come into the program, and we have a lot. I just started my leadership class last night, and I have a physician, pediatric lung cancer physician from Cincinnati Children's. And he is great. Earlier, someone asked about mental health. Another one of my fairly recent alums, I guess it was a year, she's a psychiatrist, and she was actually right when she graduated at the University of Virginia when the tragedy struck the football team there. And she was on the crisis team for that right after she, you know, left the program. But what I find most physicians on our alumni board, Karthik Ramani is a nephrology interventionalist, and he is at the University of Michigan. And I tease him that because I'm from Ohio State, I don't hold that against him. But Dr. Ramani, who is a vice president of our alumni board, is another one. And all of them were using their MHA degree to get into things like medical directorships, perhaps chief medical officers. We have quite a few of those. We have one in Brooklyn, I don't know if it's NYU or Presbyterian, but he's the chief medical officer there in emergency medicine. So most of our physicians who choose to get the degree are looking to advance in leadership within that route, within medical director, service line, you know, physician, triad models, dyad models, on up into the C-suite in many ways. So I feel like our physicians, and, you know, we can put you in touch with Dr. Ramani. He likes to talk to physicians considering the program, but I feel like our physicians are really satisfied with what they feel they get. Almost all of them highlight those finance classes, because a lot of the courses that we take as a physician, you already know how the health system works, warts and all, right? And so you know that, you probably have your leadership experience, you probably know quite a bit about quality improvement, although physicians like those classes as well. But to a person, those finance and economic classes are the most interesting and challenging to them, because it's usually something you didn't know coming in that you weren't that exposed to. So if you really want to climb the ladders, you know, as a physician, that piece is critical. Understanding the finance side, you know, as wearing your hat, your administrator hat, as well as your medical hat, and understanding how those decisions are made and what goes into that is very popular with our physicians. Hope that helped.
I I think I've been typing like a mad woman trying to get the answers as you're as you're saying them.
I talked to one of them earlier about the fellowships, and then they kept going away, and I'm like, oh my gosh, Caitlin's answering those really bad.
Yeah, but no, this has been wonderful. We've definitely gotten a lot of really great questions tonight. Now, we did originally say that this would go until 7 p.m. So for those of you who might have other commitments this evening, you're welcome to take the rest of your night, but we will stay on the call for just a little bit longer to see if any other questions pop up. But for those of you who've gotten what you needed tonight and feel confident about this next step, thank you so much for spending the time with us. And I personally look forward to seeing those applications come through. And I know Dr. Zavalos does too.
Yes.
Awesome. So
You can be
we
our
will, yeah, come be a Bearcat. So like I said, we'll stay on for just a few more minutes. So get those final questions in there because we're happy to answer them.
And Brian, Caitlin, I want to thank you for all the time you put into this as well. Preparing, you do a lot of prep work, with our folks, but also putting all this information together. And Jess, you're just always right there anytime we ask. Could not have a better alumni president to represent this program. And did anybody see my cup? I'm using my UC cup. And
I did notice that. Yeah. We're Big 12 now. We're a big deal.
We are a big deal, and it's going to take a little while to, get back to that national championship, but it's going to happen for those of you who are football fans.
Okay.
Okay.
I don't think there's any more final questions. So for anybody else who maybe has a question that they think of later tonight, the Enrollment Services team is available to you. But for now, thank you so much for spending the time, and I hope you have a great rest of your evening.
Thank you all. Thank you so much.
Thanks.
Thank you,
Have a good one.
everyone. Bye, guys.
Bye-bye.